Did that mean that you ended up with patients that became attached to you?
Well, I think they became attached to the empathy. And of course, since I was the therapist, they were attached. But now I'm retired now. I'm still licensed. And so I'm going around the world teaching parents and anyone who will listen to me in the time I have left in my life, how to connect with the people you're worried about and that you love. Let me share an anecdote which kind of turn things around. So there I was, a freshly minted psychiatrist, mentored by this suicide expert. And there was one patient that I will call Nancy. That's not her name. And she had made 2 or 3 suicide attempts before I started seeing her. And I was seeing her for about 6 months, and I didn't think I was helping her at all. I mean, really, she'd come in, she wasn't catatonic, and she would always look, 30 degrees to the left or right of me. She wouldn't make eye contact. And I used to moonlight at a state psychiatric hospital once a month where I'd cover for the other psychiatrist. And sometimes you don't sleep for 24 hours or more. So I remember I had just come back from moonlighting, and there it was Monday, and there I was with Nancy. And so I'm sleep deprived. And she's there not looking at me. And as I'm looking out of my room, all the color turned to black and white. So I'm looking out of the room, and it's black and white. And I thought I'm having a stroke or a seizure. So I did a neurologic exam on myself. I'm a psychiatrist, not a psychologist. So, I'm looking at my fingers, tapping my elbows, and like this to see if I'm all there. And I realized I'm all here. I'm not having a stroke or a seizure. And then I had this crazy idea that I was looking at the world through her eyes, feeling her feelings. And I just got the chills, and it got colder and colder. Oh, it gets more, Mikhaila. So because I was sleep deprived, I blurted out something that normally I wouldn't. I said, Nancy, I didn't know it was so bad, and I can't help you kill yourself. But if you do, I will still think well of you. I will miss you. And maybe I'll understand why you had to get out of the pain. And that was the first time she looked at me, Mikhaila. And when she looked at me, she grabbed onto my eyes like I'm grabbing onto yours. And I thought she was going to tell me, thank you for understanding, I'm overdue. So I was a little nervous because this was the first time she made eye contact. And I said, what are you thinking, Nancy? And then she leaned into me. And she said, if you can really understand why I might have to kill myself to get out of the pain, maybe I won't need to.
Wow.
And then she smiled. And then I held onto her eyes. And I said, here's what we're going to do. I'm not going to give you any treatments or that you've been through before unless you tell me maybe we should try another treatment, because this has been going on for 5 years. Would that be okay? And I'm holding on to her eyes. And she had a look that said, keep talking. She said, yeah. And then I leaned in and I said, what I'm going to do is I'm going to find you wherever you are. And I'm going to keep you company.
Man.
I just don't want you to be there alone. Would that be okay? And then she started to tear up. And, I'd mentioned before we started this.
Getting me.
Can you feel it, sort of, Mikhaila?
Oh, yeah. Well, I feel like I'm kind of in tune to those things, and I've been to some pretty dark places. So keep going.
So something we'll talk about hopefully later in the interview. I've started a company called Michelangelo Mindset. And Michelangelo has a quote that says, I saw the angel in the marble and kept carving until I set it free. So he would look into a piece of marble and see the statue of David, or he'd see a Pieta. And what I realized is with my suicidal patients, I saw the hope in them that they couldn't see or feel. And I just carved away everything that got in the way of their seeing it or feeling it. And I think what got in the way is they scared people. They worried people. I saw one patient, I said, what helps in our meeting? And he said, you're the only person I'm not a worry or burden to. I said, what do you mean? He said, my parents are worried. My siblings think I'm manipulative, which I am. The other doctors I've seen, were very good and very professional, but you have this smile when you see me, like you're glad to see me. And it's not about whether I followed, taking my medication. And so I thought you were crazy, Dr. Goulston, but you are the only place where I'm not a burden, because something people who aren't suicidal don't realize is if you feel like this burden to the world and you have no happiness, why don't you just relieve the world of that burden? So you're tracking with me, kind of?
Oh, yeah. Like I've been in chronic pain from the arthritis. I had multiple surgeries. I've been on a lot of medication. I'm not on anything anymore. Everything's in remission. I haven't taken a psychiatric medication since I was 23 and I'm 29. So I got off of those, which was hell in itself. But I am very familiar with those feelings. And my dad, we've made this pretty, we've been vocal about this, but my dad experienced akathisia from psych meds, which people kill themselves when they experience akathisia quite frequently. And so it was like just terrible. And when you're dealing with someone, or if you yourself are in that kind of state, you do feel like a burden. And you do get blamed a lot, and you're told you're manipulative. And so, yeah, I am totally on board. I also found it interesting that you said that things went black. You were sleep deprived, so there was that, but things went black and white. When I stopped taking my SSRIs way too rapidly over a period of 2 weeks, and I'd been on them for like 12 years. Bad idea. But I had very severe SSRI withdrawal. And during the first maybe like couple of years, but particularly the first year, when the withdrawal got bad, because it kind of went in cycles, I couldn't see color. Like that happened to me. Reds went less vivid and everything kind of went gray. And I was like, there's so little joy in the world. You don't even notice when color gives you joy. You don't even really notice that. But when it was away, I was like, oh, I can't even see red very well. So I must be getting some joy from that I'm not getting anymore. So yes, we're on the same page. Definitely.
Well, I'm glad you're in a better place. And,
yeah, much better.